Thank you so very much. I just want to make sure you can hear me.
Yes, we can hear you.
Awesome. Thank you very, very much. Well, good afternoon, everyone. I'm Brett Andrews, and I'm thrilled and honored to be invited to participate in this health discussion of the task force. If we can please get the slides up. As I move through the presentation, I ask that you keep active in your mind the work that we are doing is primarily based in San Francisco. Uh, uh, you'll find that having special considerations and an overlay and a lens that really makes it even more challenging and brings to light significant disparities that we're having in the Black African American community. Next slide, please. I came to San Francisco in 2003, and one of the things that I sought to do was get a very clear understanding of what city that I was moving into. After living in Los Angeles and New York, DC, and born and raised in Pittsburgh, Pennsylvania, and I read the census at the time, the narrative, and looked at the demographics. And what stuck out to me is that in a world-class city as San Francisco, at that time, the Black population was just hovering around 7 or 8%. And obviously we have shrunk to about 5%. And the question that stuck in my mind that remains today, as I haven't been able to sufficiently answer it, is either Black folks were here and they left, or they were never here, and neither or both, and neither would be a preferred outcome. And so I've paid attention to that as I've been with Positive Resource Center, PRC, for the last 19 years. I have been challenged to figure out what are the contributing factors to the challenges that we have in the African American Black community. I'll say a little bit about PRC. We started as a small HIV organization in 1987, AIDS benefits counselors in response to the AIDS crisis. We were primarily a law outfit, attorneys helping clients gain disability benefits that were being denied by the Social Security Administration. In the mid-90s, we acquired a workforce development program specifically focused on the HIV population, and came together as Positive Resource Center. As you can see, a very small budget with a powerful, mighty 7 employees who were doing extraordinary work in the community. I came on as their executive director at the time in 2003. And we had a budget of just about $1.2 million and 18 employees. And over the years, through natural growth and a couple mergers that we've had in the most recent years, we have grown that organization to about $34 million and 300 plus employees, and provide both behavioral health and HIV services in San Francisco. I will say that putting on an extra lens, obviously PRC is Black-led. It is one of the top 3 behavioral health organizations in size in San Francisco, and the largest behavioral health organization that is Black-led. Next slide, please. When we thought about bringing the organization together, there were obviously HIV programs and a series of behavioral health services that we were providing, including 9 licensed sites throughout San Francisco, providing 30, 60, and 90-day residential treatment care in substance use, mental health, and for those, there are a few that are co-occurring. And we organized our services to make sure that there was a continuum of care that went from crisis care, which are really street-based care, bringing folks in off of the street and out of psychiatric emergency services, to more stable residential treatment care. And then we do have about 140 beds of scattered site housing for people who have graduated out of the program and who are living long-term to permanent in our co-op system. We think about the determinants of health, the social determinants of health, and we took our social programs and made sure that there was a connection between those programs and our residential treatment care. Then we provide emergency financial assistance grants for clients who are experiencing a significant financial need and immediate and urgent need, medical copays, cell phone bills, utility bills, and most importantly, where a significant amount of our dollars are going, is frankly for folks to stay in their apartments, paying for rent and security deposits. We provide, as I've mentioned earlier, legal advocacy services, workforce development services, which are career counseling, computer training, job search assistance, and job placement. And of course, very important career peer counselors, folks who have the lived experience, who have been successful in going through the challenges and that they've had in their life and finding themselves in a space of triumph and being a witness and a support to those who are going through the process now. And this continuum of care and its wraparound services really speaks to serving clients without the barriers of siloed funding, but really wanting to serve the person through a whole person care model. Next slide, please. In about 2000, just at about 2018, the Department of Public Health did its first Black African American Health Report. And as you can imagine, it pretty much in every indicator, every metric, every index, African Americans came in last. And I put, while there are many startling statistics that are in that report, I pulled out a few of them that are just incredibly heartbreaking. And I again will remind you, we're talking about San Francisco that has a population of under 1 million, about 840,000. It has an annual budget of about 13.2 billion, which is more the size of a budget for Chicago. It has a pretty strong ideology and shared ideology. And we have a small population to deal with that is disproportionately being impacted in many ways. And so with African Americans, Black African Americans only making up 5% of the population, we make up 37% of the total homeless population. Embedded in that percentage is also about 25% of those who've been on the street for 10 years or longer. 19% of Black African Americans represent the behavioral health services, again, reflected against the 5% of the total population, Black African American total population. And while our unemployment are hovering around 3%, our unemployment rate in the African American community is about 18%. We are 2 times more likely to experience a disability in our lives, and we have a very low median income of about $30,000 a year. We have the lowest non-graduation rates at 63% versus a general 16%, highest mortality rate in 9 out of the top 10 causes of death in San Francisco. And as the presenter spoke to earlier, statewide, while we make up 6% of the state, we hold approximately $4,000 in general household wealth as compared to the white population with $355,000 as a household wealth. Next slide, please. That sparked a lot of discussion, obviously stirred up a lot of emotion for myself. And I thought while I was the CEO of PRC and proud to be in this role, there had to be something more that I could do. And if there was more that I could do, I knew that there were other caring Black leaders across the city who would be interested in this work. And so I reached out in 2019 to a group of 45 Black leaders and asked them to come and ask ourselves the question and challenge ourselves to come up with an answer of what we could do and how we could formalize an effort and an initiative to address some of these issues. Because again, San Francisco being a very wealthy city and county that has a significant amount of control, one would ask if all of that is those resources are at your fingertips and at your disposal, how in the world could you have such paltry outcomes compared to any other state, particularly those that are in the South? And we decided to form ourselves into the Black Leadership Council. And our mission is to advance meaningful change across our systems of care that have historically harmed Black health, wealth, and prosperity. and we seek to bring change through legislative and partnership strategies. And we are going to do this focusing on 4 policy pillars of health, wealth, housing, and education. All 4 of them referenced often throughout the previous presentations that we've heard. Next slide, please. Some of the great outcomes that we've had over the past 2 years is we have had a significant amount of meetings at the state level with legislators. We've supported 23 bills that are germane to the topic and have done public testimony throughout the last 2 years. We've supported some significant bills that we feel help to address racial inequities, SB 17, the establishment of the Office of Racial Equity, AB 1406, was Assemblyman Burke's bill with nurses and healthcare providers implicit bias, and SB 2, who I know Senator Bradford is on the call, and actually we had the honor of having him come and present to us and allowing us to share with him our strategies and our goals and ways in which we can work together in order to address quite a significant existential issue that is in front of us. And that particular bill on the civil rights around officers and certification, just greater accountability in officers' behavior. We made some recommendations that fit within our prosperity agenda, thinking about debt relief provisions that hold back the Build Back Boldly budget that we are thinking about, CDE, which is an alternative solutions for preschool expulsions and suspensions, and certainly capacity building and trainings that we're looking for in Black-led organizations. Next slide, please. So what are some of the critical social issues that we are facing? There are many, but these, again, germane to the work that we are doing here at PRC and in San Francisco. We recognize that there was an apology that did come out from the American Psychological Association that said that they indeed recognize that they played an active role in creating, sustained, and promoted a view of people of color as deficient or damaged. And we, again, saw that in our previous presentations. And so there is a history of misdiagnoses of Black African Americans. We know that there is a lack of diversity in the medical field. And while we make up about 13% of the US population, we only make up about 5% of the physicians in the United States. The disproportionate representation of homelessness and behavioral health issues. There's with a significant rise in San Francisco, San Jose, and in Oakland. There's a 9% rise overall in homelessness since 2019. And importantly, while African Americans are facing these challenges, we know that there's another challenge that is above it that lives at an institutional level, that there is a history of underfunding Black-led organizations. And we have found in a recent study that they are about 24% smaller in revenue and have less opportunity to access significant funds in order for them to provide their service to the fullness of their capacity. Next slide, please. So I would like to present to the task force a few ideas and recommendations on research and investments and thinking about where we should go from here. I think that we should spend some time thinking about the need for significant investments in Black-led organizations that are serving our California's diverse populations and communities that have a cultural lens put to them, that are meaningful and community-based. I think that we should create more diversity in the workforce, a pipeline of medical and behavioral health professionals to address the cultural considerations of clients served in Black-led behavioral health and other health organizations. I believe that we should require ongoing meetings with national health associations like the American Medical Association, the American Psychological Association, and others to create joint educational and research opportunities. We should conduct comprehensive reviews of healthcare policies within governmental entities to unveil where and how implicit and explicit racist policies and practices are embedded in the creation and the provision of services. We should create and deepen relationships with faith-based organizations and institutions as a primary place to do outreach in the community. I want to say a word about that, and I know Member Brown is on and Reverend Brown is on, and I believe, and I know he supports this, that we should focus energy and attention on bringing the secular work and the faith-based work together, because so much of our lives are tied to the cultural and spiritual dynamics that are active in our lives. And I think about that in the HIV work that we have done and continue to do, and what role the church can play in elevating those conversations and bringing people together who might not come together otherwise to talk about serious, critical health-related issues. And then I think we should enlist public figures to elevate and broaden the discussion of health equity by sharing their stories and making strategic investments in the community. We saw that when Magic Johnson was courageous and brave enough to come out and share his HIV status, and then put his money where his mouth is and create a series of community-based clinics where, if indeed he had not had the courage and the bravery to speak his truth and his reality, that so many people would have died because of it, and they would have died with it, believing that it is their secret and their secret alone. So I do encourage all of us who have some level of influence as a leader in the community to speak your truth, as certainly as an individual, as a community leader, and in the professional role that you are in. I do believe storytelling is important, and I believe stepping into the fullness of our truth can go a long way and help countless individuals. With that, I'm going to stop there, and I just want to thank everybody for their time, for their courageous work and discussions. I know that it is difficult because we represent what we are trying to solve. And one of the things that we talked about at the Black Leadership Council is, in the storytelling, in doing the work, let's not ignore the fact that we ourselves are human and that we are suffering through it, and how great it is that we have come together to go through this struggle together, knowing that collaboratively that we can come to the other side. And so again, with that, I thank you all for your time and your attention to this critical issue, and I'm happy to answer any questions that you may have.